Hi, I'm Dr. George Shashoua, and we're here to talk about labiaplasty. And I figured the best way for us to discuss labiaplasty was to do it in an informal setting with the people around this table. Around this table, we have some students, nurses, and nurse practitioners. So just going around this table, this is Ashley Kim, and she is a college student going to med school next year. So she could give us kind of the student type questions that would come up. This is Sarah Steers, one of the nurse practitioners, who's been here for a long time and knows everything about labiaplasty. And this is Marissa. She's our always smiling, always coming up with new stuff, medical assistant who also is our social media star. This is Kristen Longshore. She is also a nurse practitioner who's been with us for several years and has thrived in the cosmetic setting. And this is Marcy Sanchez. And Marcy's a senior at UT and going to be a physician's assistant and go to physician assistant school.
What influenced you to do labiaplasties?
So as a urogynecologist, when doing procedures, a lot of patients that came in for prolapse of the vagina also had enlarged labia. So I did do those procedures occasionally in the beginning part of my career. Over the years, it became a more requested procedure, so I did more and more of them. As I did more and more of the labiaplasties, I appreciated the complexity of the procedure. So it went from a simple procedure of just excising the labia became a much more extensive procedure as I started to do more and started to see much larger labia.
And Sarah, how many labiaplasties do we do in a typical month, and how many have you done total?
Yeah, so we do about 2 labiaplasties a week, 2 to 3, so on average around 8 a month when they're done here in the office, and we've been doing them for a few years.
Okay, so Kristen, what can women expect long-term following a labiaplasty procedure?
After a labiaplasty procedure, recovery is about 6 weeks, and typically after your 6-week mark, you're really going to notice the full appreciation of the labiaplasty. It takes 12 weeks total, but usually around 6 weeks you get a pretty good idea. After about 12 weeks, you'll notice a significant reduction in the size of the labia, and then once that is removed, that should never recur. We get many women who are very happy, actually all women who are very happy post-procedure, and are kind of able to get back to their normal routines.
And Dr. Joshua, how has your technique changed over the years and why?
So when I was doing it in the operating room years ago as part of a prolapse surgery, most of the procedure was just taking out the labia itself and then just suturing the labial edges. And as time went on, I started paying attention more to the skin at the opening of the vagina, because that skin is also enlarged in a lot of patients with enlarged labia, and then also the skin around the clitoral area. The skin around the opening of the vagina was somewhat very natural because it's what we do during many of the procedures we do anyways. The skin around the clitoral area, that technique has evolved over time to just see which way it kind of settles best and which way it looks most natural. There's techniques that are talked about like the wedge and the trimming technique, and the bottom line is you want the labia removed and then the transition between the clitoral area and the labial area to be smooth. And then the final major change has been in patients where a lot of the labia is bunched together and it almost looks like the clitoris has descended or dropped a little bit. Those patients, I'm elevating the clitoris or doing a clitoropexy, and that's really been a game changer.
All right, so next question, Sarah, there is a misconception that labiaplasties are solely for cosmetic purposes. How would you dispel this misconception?
Sure, so we offer labiaplasty for cosmetic reasons as well as for comfort reasons. I think we've probably been surprised at how many women come in who are athletic or practice yoga and complain of discomfort in tight clothing. They feel self-conscious in exercise classes or just uncomfortable with cycling and that kind of thing. So we do for both reasons.
And Kristen, so what changes do you see in confidence following a labiaplasty?
We get to know our patients very well over the pre and post-op periods for labiaplasty procedures. And a lot of times we do have patients that come in who are very shy, very uncomfortable, and unfortunately embarrassed about kind of a natural just variance in their anatomy. So post-procedure, we get a lot of women who kind of feel this renewed kind of sense of sexuality. We had a patient who was going on her honeymoon pretty soon, so she was really excited to be able to wear a bathing suit comfortably and just kind of feel confident, feel sexy. So we definitely see a big change in this.
And then back to Dr. Shashoua, what do you think sets your labiaplasty skills apart from other plastic surgeons, or dermatologists, or even other gynecologists?
So I think with the plastic surgeons, they do a very excellent job on taking care of the way the skin looks after the surgery and how the skin settles. But they don't really, that's not their area. So they end up doing a somewhat very precise surgery on the labia itself and sometimes on the clitoral skin. With the dermatologist, that's their area is the skin. So they tend to do a nice job with just cutting the skin and bringing the skin together. Gynecologists would also focus mostly on the labia. I think here we do the most comprehensive thing where we know how to make the incision and the skin heal well. We pay attention to not just the labia but the clitoral area with the clitoral hood and then the clitoropexy and then also the opening area to give the most natural result.
And Sarah, are larger labia usually genetic?
Yeah, so we definitely see a lot of women who say that they started to notice the labia seemed a little bit larger than normal or bothersome size around puberty after they start their periods. I think in those patients there's definitely a stronger genetic component and they tend to have the more prominent labial skin.
Okay, and then Kristen, so how have you seen the results of your procedures impact your patients' lives? And what advice would you give patients who are hesitant to moving forward with this procedure?
So I think as far as kind of how it impacts patients' lives, it goes back to the confidence and the ability to kind of get back to normal activity or activity that patients were previously hesitant to participate in, like horseback riding or cycling, just because it was uncomfortable. And as far as kind of patients who are hesitant to move forward for the procedure, anytime I do a consultation for a labiaplasty patient, I let them know, first and foremost, there's nothing wrong with you. And I think that's the most important kind of take home for patients who come in with enlarged labia. There's nothing that you did to cause it. It's a natural variance. Everybody's vagina is a little bit different. And the matter, it kind of comes down to what makes you feel most confident in your sexuality, what makes you feel the most comfortable, because ultimately at the end of the day, it's you that has to live with your body. So, our goal is to make you a confident, happy, healthy woman.